Hi, this is Sean, and you're watching Gnostic Psych, where I share with you arcane and interesting stuff about psychology. If you like what you see, please click the subscribe button. Today I'm going to be talking about how the medical model of psychology came about. Psychology is a soft science in comparison to other sciences, yet psychology uses the medical model to help presenting clients as far as assessment, diagnosis, and treatment. So how did this field adopt the medical model and why? The history of how this occurred is pretty fascinating, but barely known outside of the field. As a graduate student, I can only remember off the top of my head one class I've taken in all the years of classes that covered psychology's history as a branch of neuroscience. I think that this history should be covered more often, as it gives greater credibility to psychology as its own science, rooted in medical science. Because contrary to popular belief, psychology did not start with Sigmund Freud. This study of mine goes all the way back to ancient Greece and China, even earlier. Modern psychology's history began in Germany during the 1800s when neuroscientists began trying to figure out whether the disease syphilis was the cause of a mental condition called general paresis. Neurologists were ultimately seeking a cure because syphilis was widespread at the time. In fact, mental institutions were overpopulated with people who were delusional and paralytic from the effects of general paresis. Neurologists and neuropsychiatrists were conducting experiments on paretic patients that today would be considered a violation of the Nuremberg laws. But medical practices of the day aside, the research led to sweeping changes in the mental health field afterward. In 1876, a neuropsychiatrist named Alexander Rosenblum tested his theory that inducing a fever in a patient with general paresis would cure the person of their symptoms. He proceeded to inject 22 of his patients with malaria and typhoid. 11 of the syphilitic patients out of 22 were cured by the fever. However, Rosenblum's discovery was buried in an obscure medical journal for decades afterward. It wasn't until 1917 when German neuropsychiatrist Julius Wagner-Jauregg was treating a soldier with tertiary malaria and took a sample of the patient's blood and injected it into 9 of his patients with general paresis. Out of the 9 who were exposed to malarial fever, 2 were unaffected, 1 died, but the other 6 showed improvement. Ultimately, 4 of the 6 later relapsed back into symptoms, but 2 completely recovered from paretic symptoms. Wagner-Jauregg was awarded the Nobel Prize in 1927 for his treatment approach. In 1897, German neuropsychiatrist Richard von Krafft-Ebing was involved in an experiment where 9 paretic patients were injected with syphilitic tissue material in order to find out if general paresis was caused by the disease. None of the patients experienced second stage syphilitic symptoms, which basically showed that there was an immunity. So basically, through the immunity, he was able to find out that having had syphilis before and not having effects from it again, there was a link. Krafft-Ebing is best known for his 1886 book on human sexuality and all of its variations and deviations called Psychopathia Sexualis, and for coining the fetish terms sadism and masochism. He also popularized the terms heterosexuality and homosexuality, which were first coined by Austro-Hungarian journalist and gay rights activist of the time, Karl Maria Krafft-Ebing, in 1869. Krafft-Ebing gave his reference in support of Austrian medical doctor Sigmund Freud's application for a teaching position at the University of Vienna. Although he disagreed with psychoanalysis, he agreed with Freud's arguments about the connection between sexual drives and mental illness. German psychiatrist and founder of psychology's medical model, Emil Kraepelin, began his career in the neurological melee. Though he believed that mental illness has biological origins, he disagreed with neuropsychiatrists not offering therapy to their clients. He subsequently developed the first diagnostic classification system of mental disorders based on etiology or long-term development. At that time, mental disorders were considered diseases of unknown biological origins, like general paresis from syphilis. Therefore, Kraepelin adopted the medical model for treatment. Some terms of the terms he first coined in his diagnostic system were depression, which replaced melancholia, manic depression, which was later renamed bipolar disorder, and dementia praecox, which was changed to schizophrenia in 1911 by Austrian psychiatrist Eugene Bleuler. Freud's psychoanalysis grew in popularity in Europe during the first few decades of the 20th century, thus filling the therapeutic void of the burgeoning psychology field.